Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on nervous system. Let's get started with question number 1. For the following case, which of the following is the most likely way that this organism reached the meninges? A. Middle ear to contiguous tissues then to meninges. B. Pharynx to blood then to choroid plexus then to meninges. C. Pharynx to lymphatic system then to meninges. D. Primary lung focus to blood then to meninges. E. Traumatic wound leading to leaking cerebral spinal fluid then to meninges. The case scenario is: a 21-year-old man is brought to the emergency department by his roommate due to worsening fever, headache, and confusion. The patient recently moved to a dormitory, and his prior medical problems and immunizations histories are unknown. His vital sign temperature is 39.2 degrees Celsius, blood pressure is 98/54, pulse rate is 112 beats per minute, and respiratory rate 24 breaths per minute. The patient appears acutely sick-looking. He is obtunded and has nuchal rigidity. Leukocyte count is 19,000 per millimeter cube with left shift. Blood cultures are obtained and lumbar puncture is performed. Gram stain of cerebrospinal fluid reveals gram-negative cocci in pairs. The question is: which of the following is the most likely way that this organism reached the meninges? Your options are: A. Middle ear to contiguous tissues then to meninges. B. Pharynx to blood to choroid plexus then to meninges. C. Pharynx to lymphatic system then to meninges. D. Primary lung focus to blood then to meninges. E. Traumatic wound to leaking cerebral spinal fluid then to meninges. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is pharynx to blood then to choroid plexus then to meninges. This question is designed with the focus to assess your ability to apply foundational science concepts. Acute bacterial meningitis is a life-threatening infection that classically presents with the triad of fever, nuchal rigidity, and altered mental state. Most cases are caused by Streptococcus pneumoniae, which is a gram-positive coccus, and Neisseria meningitidis, which is a gram-negative diplococcus. These pathogens are transmitted via aerosolized droplets and are able to colonize the nasopharynx due to the presence of specialized surface components, like fimbriae and pili. Colonization usually leads to an asymptomatic carrier state, but in a minority of patients, approximately 0.2% of cases, the bacteria penetrate the epithelium and enter the bloodstream. Intravascular survival of the bacteria is dependent on capsular polysaccharides, which allow the bacteria to evade destruction by the alternative complement system. Meningitis occurs when the bacteria penetrate the cerebral capillary endothelium or the choroid plexus, the location of blood-CSF barrier. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. Choice A cannot be the answer because Haemophilus influenza and strep pneumoniae can rarely spread into the meninges from a middle ear infection. However, an ear infection is very uncommon cause of meningitis. Choice C cannot be the answer because spread from the pharynx through the nasal lymphatics to the subarachnoid space may contribute to some cases of bacterial meningitis. However, this route is thought to be far less common than bloodstream invasion with subsequent hematogenous spread. Choice D cannot be the answer because infections of the lung, like Mycobacterium tuberculosis or strep pneumoniae, can lead to bacteremia and meningitis. However, Neisseria meningitidis does not usually colonize or infect the lung. Choice E cannot be the answer because traumatic brain injury can lead to CSF leaks, with subsequent infection of the central nervous system. This is particularly common in the setting of basilar skull fracture. Strep pneumoniae, a gram-positive cocci in pairs, is the most common organism. Your take-home message from this question is that Neisseria meningitidis is transmitted primarily by aerosolized droplets and subsequently colonizes the nasopharyngeal epithelium. Penetration of the epithelium can lead to bloodstream infection. Spread to the meninges occurs via transcellular penetration of the cerebral capillary endothelium or entry at the choroid plexus. Did you get the answer? If you believe you have the answer, click above to move on to the next question. On the other hand, you must watch this episode again if you are unable to accurately respond. Keep in mind that knowledge is essential for advancement. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Make sure you and your friends are ready by clicking the like button, sharing this abundance of information, and becoming a channel subscriber. Never forget that your success is only a click away.